Dear patient, thank you for taking the time to learn more about PRP procedures. Generally speaking, PRP procedures come under the general heading of autologous medicine. In other words, we take your own blood products and give them back to you with absolutely minimum processing, and it's all regulated by the FDA. Dear patient, let's start out with a standard disclaimer. This presentation is for informational purposes only, to be used to help you guide the right questions to ask your doctor, whether it's regenerative medicine or PRP or bone marrow aspirate or any other injection or treatment of any kind. Those decisions should be made only upon advice of your own physician, whether it's us or another physician. However, you may use this presentation to guide you to ask the right questions to determine whether this treatment is right for you. As you can see in this slide, PRP stands for platelet-rich plasma. The first P is platelet, the R is rich, and the third P is plasma. There are also other options for mnemonics. There's platelet-poor plasma, there's leukocyte-rich plasma, there's leukocyte-poor plasma. We're not going to be covering those topics here. We're really only going to be discussing strictly PRP, which is platelet-rich plasma. Platelets are tiny little blood cells that help stop bleeding and heal wounds. As you can see in the photo on the bottom right, they are made in the bone marrow from much, much larger cells called megakaryocytes. The bone marrow is the source of all blood cells, and it is bathed by plasma. While it's easy to determine if the bone marrow is functioning normally with respect to platelet counts on a complete blood count, there are patients who have abnormally low or abnormally high counts of platelets, known as thrombocytosis or thrombocytopenia, which can cause a variety of bleeding disorders, either too much clotting or too little clotting, as you see here in these pictures. Also, on a complete blood count, if indicated by your physician, we can measure red blood cells or erythrocytes, or white cells, which are leukocytes, also which have important functions in modulating oxygen delivery, carbon dioxide removal, and also immune functions. And that brings us to the major component of whole blood, which is plasma, a life-saving liquid which can be donated to help people with bleeding disorders, immune deficiencies, burns, or shock. As you can see in the tube on the top, this tube has been divided into clear plasma and red cells. On the bottom left, you can see a number of different tubes. The most leftward tube on the bottom is clear plasma with cells, and the rightmost tube on the bottom is plasma that contains red cells, platelets, and white blood cells or leukocytes. So using various techniques, you can take out pure plasma and put back in other components such as platelets, red cells, white cells, etc. And so, for example, white cell enriched plasma is called leukocyte-rich plasma, and if you take out the white cells, it's called leukocyte-poor. And as you can see, you can say erythrocyte-rich or erythrocyte-poor, and of course, platelet-rich or platelet-poor. You can basically minimally modify the components of this right in the office to give you the type of plasma that you're looking for, depending on the condition that you intend to treat. Putting it all together, whole blood can be processed minimally just to include the components you want. So, out of the red blood cells, the white blood cells, the platelets, and the plasma, you can just have plasma and platelets, which is known as platelet-rich plasma. So it's just a matter of minimally processing the whole blood to include or exclude the components you want to see more of. On the right, you see similar equipment being used for a very popular technique on the left called the vampire facelift. Again, these are not our patient files. We do not perform cosmetic treatments, and we cannot say anything about the results, which are reportedly in the center of the screen. However, we use similar equipment using different formulas and different concentrations of cells targeted at different areas, but you can see that some of these equipment and technique formats have become very popular. Some popular uses of PRP are for hair loss and cosmetics. Again, these are not our patients and not our results. We found these photos on the internet, and we do not perform these procedures here at Pain Care Physicians. The biggest reason why we do not perform cosmetic treatments using PRP at Pain Care Physicians is because our physicians have taken extra time to gain expertise in image-guided evaluations and treatments. On the left, you see an ultrasound image showing a tendon, a muscle, and a bone. Our physicians are able to guide treatments directly to the area of the problem using direct visualization using these advanced techniques. On the right, you see an X-ray fluoroscopic image of a lumbar facet and a needle being guided carefully directly to the joint. Again, these are treatments that we focus on at Pain Care Physicians. We do use image guidance when needed to perform treatments, and cosmetic procedures, most of them just don't require this level of image guidance. And so for that reason, we've just chosen not to engage in cosmetic treatments. That's the most important reason. There are other reasons, but that's the most important. So while many clinics are now offering PRP treatments, which have become quite popular now, we at Pain Care Physicians focus on delivering high-quality, image-guided techniques as closely to the site of pathology as possible. So with increasing popularity of PRP treatments, it's important that you do your own research. You can easily go to the National Library of Medicine, the NIH website, and do an online search, simply typing platelet-rich plasma or PRP and the condition that you're interested, and it will produce a number of articles for you as seen here on the NIH website. PRP has also been studied in some of the nation's most prestigious universities, such as the Mayo Clinic, Johns Hopkins, and a number of orthopedic journals. Adding to the debate, a number of physicians, such as the one you see here on the right, Dr. Mancini, have criticized the Journal of the American Medical Association, a prestigious journal, which studied platelets versus placebo and found no significant difference in the platelet group compared to placebo. Dr. Mancini and other physicians criticized JAMA as using concentrations that were too low to be effective. So as there is evidence for use of PRP, there is also evidence that it doesn't work, and so it's important that you speak with your physician to determine which treatment is right for you, which concentration is right for you, and what you can expect in terms of recovery. Here is yet another article comparing intra-articular joint injections of placebo, steroids, hyaluronic acid, and PRP, and there are numerous studies like this out in the literature with various results, all using different techniques, different underlying conditions, different concentrations of treatments, and some using image guidance and some not. So again, it's important that you understand the background to ask the questions and then determine with your physician whether this treatment is right for you. Let's focus now on the 4 practical steps that you will need to consider in order to have a PRP treatment. Effectively, we distill this into 4 steps shown here. Step 1 is collecting the blood. Step 2 is separating the platelets. Step 3 is locating and obtaining the platelet-rich plasma PRP. And the 4th is return of the PRP to the patient. At Pain Care Physicians, our standard is that one of our amazing licensed nurses will gently draw your blood using a butterfly technique in this small needle to draw out a generous amount of blood for processing. After the blood is obtained and while you wait, we process the blood in a specialized area using an ultra-fast centrifuge to achieve the desired designated quantity and concentration of platelet-rich plasma. In these diagrams on the left, you see whole blood in the form that it comes out of the vein. In the middle, 1 centrifugation, and on the right, a 2nd centrifugation, again using specialized formulas and techniques to achieve the desired result and concentration. Here is an image we freely obtained on the internet of a physician guiding a needle to the shoulder using a posterior technique and an ultrasound machine. This would be typical of how we would perform an ultrasound-guided PRP injection. Here are some more stock images we obtained freely on the internet, not our patients and not our models. At the top, you see a cervical facet injection diagram with PRP. On the bottom left, a knee injection without guidance. On the bottom right, a syringe simply rests next to a diagram of the facet joint, and on the right, a proposed approach for the shoulder using a lateral technique. These are just stock images we obtained on the internet to show you how potentially PRP can be used to treat different areas. We place this slide here to remind you that PRP treatments are not for everyone. There are special considerations. One must take into account the risks versus the benefits of any treatment. If you have an infection, if you have autoimmune disease, if you have a bleeding disorder, high or low blood counts of anything, it's important that you discuss with your medical doctor the option for doing a PRP and whether the risk versus benefit is right for you. Thank you for taking the time to review this presentation. Please keep in mind that this video is for informational purposes only and not intended to substitute for medical advice. All treatments of this type or any type should always be discussed directly with your own medical provider. None of the images are from our patient or client files. All of the images were freely available on an internet search. If you are our patient, please feel free to reach out at your convenience to discuss whether any of these treatments are right for you. If you are not our patient, please reach out to your own medical provider, and we wish you all the best in your healthcare journey.